theme and very popular these days in the European Union. But during the presidency, you only have 6 months. You have the legislative files as well, so there's not enough time to have. I would suggest that this is brought forward, but it's not actually for our presidency anyway to have these kinds of conclusions. There's not enough time, but hopefully Ireland will do.
Okay. So, are there any Irish members present? If not, I'm sure you want Irish members. Let's see what pressure can be put on the next presidency to do something. Who else would like to make a point, ask a question? Yes.
You just heard that there was a WHO action plan that was published.
Can you just say where you're from?
My name is Marguerite, I'm a clinical immunologist, medical director of GSK, and you've just alluded to a publication by WHO on the action plan. Now, let's face it, WHO is a very powerful organization, has got an independency and a power to recommend actions to countries. There are representatives from different bodies into WHO. Now, it's my opinion that although WHO has been under severe fire during the pandemic crisis, I do think WHO has a critical role in going through the political era of countries to say, well, this is an action plan written by experts. Why don't you, as a country minister or as a public health authority, act and write and convene for a plan? We would be great to help you in that. Why is WHO not also, as an independent body, supportive of their own plans to the countries?
Thank you for thinking so highly of us. First of all, that's very kind of you. What WHO does is, by the mandate of the member states, we produce technical documents. And sometimes these technical documents are also policy documents. And then the member states, the WHO puts these forth as recommendations to its member states. Now, from that point onward, it has to come from the governments, the wish of technical support from WHO. WHO does not go to an independent state and say, look, you have to change your policy to fit our recommendation. How it works is a member state looks at the recommendations of WHO, thinks it's feasible, it's acceptable, adoptable, and if they want to do it, they go about doing changes. If they need support, they ask the country office or the regional office or the headquarters to work together. Of course, when we put forth our recommendations, we of course try to sell it to the countries. Okay, that's not to say that we just put it there and don't do anything about it. We of course we try to justify why we think these are worth pursuing and what the benefits will be to the country in every recommendation that we put out. And we will try to do that in the area of viral hepatitis also. However, this is where the importance of collaborations come out. Okay, so we, as a speaker spoke today, we, was it you? I think you said that the health change is not dependent on the doctors any longer, and that has been the case for a long, long time. And the health environment change is not only in the hands of WHO. You know, there are many, many players, and there are many more players coming into the field of health every day. We saw this very clearly during the pandemic also. So, as I said, this is where the collaboration, the need for collaboration comes out. So, when WHO puts forth a recommendation, if different groups take this on and critically evaluate it and put forth their support to the WHO's recommendations, that is going to make, I think, a more positive change in the world. Thank you.
Okay, I think when you were making that quotation, I think Desi was quoting Margaret Chan, actually, so it's, so it's a very good source. Desi, would you like to say a word?
Yeah, it's always good to quote your boss, especially if it can go back to her. So I just want to put the other hat, the head of chair of the Standing Committee of the European Region of the World Health Organization. What Charles was saying about developing a regional action plan, that actually is happening with a lot of other diseases. Last year, the WHO Europe region developed an action plan for NCDs, the year before an action plan for prevention and control of tobacco use, etc. So it's a natural step to go in the direction of developing a regional plan and a global plan as well. And what actually has been very helpful, Bulgaria used the regional plan, action plan for non-communicable diseases. The indicators that were developed and the targets that we were to follow that were already adapted for Europe, we could just pretty much take and place into our plan. So that really eases and can solve the problem with the data. So I am committing here that on behalf of Bulgaria, as a chair of the Standing Committee of WHO, we would propose that the regional office in Europe puts that into their agenda for this year. So I hope that next year at the meeting we can be saying that we've made some progress on developing that.
Excellent. You heard it here first.
My name is Gaëtan Maldemans. I'm working at the Public Institute of Public Health in Belgium. And I'm not talking in the name of the European CDC. This said, I would like to comment about the lack of data, and this is really true, there is a lack of data, but I believe we have to say there was a lack of data because ECDC had made a tremendous effort in the collection of data. First of all, they made recommendations, but they made as well drug definitions, case definitions, which were harmonized for all European countries, for all member states. Based on this, they collected data, and before there was a problem about harmonization of the data, and I believe this is the real problem of hepatitis C and B collection of data. There is a lack of harmonized data, especially in the European community. And due to the harmonization of the definitions of the cases, they tried to prevent this. So that's my comment I would like to say here.
Thank you. As the rapporteur for the report which established the ECDC, I'm always very pleased to hear praise for its work, and I totally agree with that. And in fact, I should have referred to that earlier. But Charles, you did, and do you want to say anything in addition to that on the work of the ECDC in this area?
No, I mean I'm delighted that it's happening, but I'm not even sure that any of this is finished yet. I don't think the harmonised data is being collected. I know they put out, you know, a new set of standards, but I'm not sure whether they've started to get the new data in a harmonised way yet. So I still think it's a bit of a work in progress, and it's fantastic that we're moving in that direction.
Okay, one last question. Point.
I want to bring a comment on this.
Oh.
Just to bring here one comment on your point, because I'm coming from Germany, and so I thought we had a very good surveillance system by our Robert Koch Institute. And so our Robert Koch Institute pointed out 0.5% of hepatitis C prevalence, 0.5% of hepatitis B prevalence. But now we have realized that this data are more than 10 years old. And if you go more in these high-risk groups, you have to estimate under another column of this data. For example, we have done some surveys in Berlin or Frankfurt. Then suddenly we point out that we have in those cities 2.1. And even in cities, our government said, well, you have to look there. We have 1.1. This is one of the facts. The other thing is I visited a lot of countries in the last 3-4 years. And in some cases, the government underestimates the number of infected people so much that there's a discrepancy of do we now need action or not? And I think this is a role I'm very happy that the ECDC is on the right way. And but if you can see here now, the data from 2010, the last surveillance of the ECC, we still have gaps there. And we still have gaps in the high-risk groups. And this is something we need for the future to set up strategy plans, because if you've seen, in some of these high-risk groups, we don't have data. So I think it's the progress, and if, as long as we all work together, I think we're on a good way.
Okay, that's a good phrase to end on, I think. Let's work together, because I think that's the what we need in this whole area on a range of issues. And with that note, can I, on your behalf, thank my excellent team that I've out here, Desi and Lucas and Handa and Charles, for their very good presentations and discussion. Thank you. Thank you. And shall we, if we can leave the stage, because I'm going to now leave the stage to Antonia, who's going to come and say a few words by way of summary for the day.
Thank you very much, and it has been a long day for all of us, I think, but I'm very pleased actually doing the closing remarks today, and I hope that you had a very fruitful discussion and very pragmatic one. I'm actually very pleased to hear that my country is a term of reference in a positive way, or it's on the top of a list for best practices, which does not happen very often. And I will keep remembering and referring to this. I would like to start first by congratulating Alpa for having organized this meeting, and as well as the panelists, speakers and the participants. And as you know, I am of the strong advocates of the evidence-based approach in policies, and especially in health policies. And especially during the time of restrictions, austerity measures, which have been proven that started from the healthcare systems and from the health budgets. So it's very important actually to make a priority, the right priority, evidence-based, and to put the money where they will mostly work. I know about many other campaigns in the Parliament, and my colleague John Bowis will support me in this, when there are more prestigious diseases as cancer, diabetes, etc., which are actually collecting the attention of policymakers and dragging us to putting some money for innovation, putting some money for supporting NGOs, and also for national plans for strategies. But when I looked, I don't know whether it is true. First I thought there is a mistake in my briefing note, but it says that about 150 million people are chronically infected and are at risk of developing liver cirrhosis and or liver cancer. I don't know whether this is about Europe or worldwide, but it's quite worrying actually. And sometimes there are diseases which are having a couple of thousands, hundreds of thousands patients, which are actually by having a strong message or directing the strong message to the right audience, especially decision-making audience, are getting substantial financial portfolio and substantial attention in the policy-making process. That's why I would like to make three major points. First, as a concluding remark, I would like to tell to all of you, take the message home and work with your decision makers, work with your parliaments, and try to insist of having these national strategies and national action plan. Because it has been proven that in the countries that have undertaken it, it has a positive outcome, and it's also a good reference for best practices. And it's very important from the discussion today to pass the messages to the national governments so the national plans can be initiated for those countries, and it should be tackled as an issue of inequality. So my second concluding remark, which will be directed to myself and to my colleagues in the Parliament, that we have to be a little bit more committed, and we have to start encouraging the Commission and the Parliament to take action, because when we talk about communicable diseases or cross-border diseases with cross-border impact, It's no longer a subsidiarity issue. It's no longer up to the national government or national parliament to take a decision and to prepare an action plan. It's something that should be tackled at EU level. And that's why I will pass this message to my colleagues, and for the best possible interest for the decision makers, for the, also for practitioners, and also for the patients, and mainly for the patients and for the interest of the patient, I think we should have some leadership in the parliament towards this issue. My third remark will be more to call to all stakeholders, including politicians when we talk about health in Europe. So the hepatitis health index is ranking member states which are belonging to the Union, to the European Union. And it's a very good tool. I think it has been proven to be reliable. And this is a tool which is actually detecting severe inequalities. These are health inequalities. The Parliament already has had a resolution on health inequalities. There has not been much which has been delivered, neither by national parliaments, not much opportunities also for the Commission, but the Parliament is very strong on this. Because the health inequalities are the severest way that we may prove that we have a negligence or discrimination in our decision-making process and in our policies. And that's why I should say that together with ECDC and with a stronger lead and the evidence and the proof by the index, we should work together on EU strategy. We have to be a little bit more courageous and ambitious, not just having national strategy and national action plan, but to have an EU strategy. So once again, I would like to thank all of you, to wish you very strong courage, and I hope that in the European Parliament you will find members which will be committed towards issues related to early diagnosis, to best possible treatment and prevention of the disease. And I hope it will deliver. There will be results out of this. Of course, it takes time, but if we don't do it now, and if we don't do it together, it will prove of having disastrous impact later on the life of our population. And now, it might be cynical to say, but during the economic crisis, more and more we are talking about healthy population and healthy workers. Unhealthy people, chronic disease people do not contribute to the GDP. It's very sad to say, it's very cynical to say, but it's true. So that's why we have to invest in healthy population. Wish you good luck, good health, and safe trip back home. Thank you.
So, dear all, many thanks to Member of European Parliament, Antonia Parvanova. It is a pleasure to have you again with us, and we look forward to confirm working with you in future. I would like to thank all speakers for their contributions and the audience for making this conference so dynamic and interesting. This has been a great event. We have listened to the specialists and policymakers. The picture of hepatitis care across Europe can certainly be improved. As President of ELPA, I can say that if patients would be more closely involved in the decision-making process, things would be different, and I think the situation would be much better. I would like to call on decision makers to encourage the active involvement of patients when developing national plans. The key findings are the following. Significant shortcomings in all categories across all countries. High prevalence of viral hepatitis, low detection rate due to lack of consistent screening programs, especially among the population in high risk. Significant increase in late stage of viral hepatitis, in particular cirrhosis and hepatocellular carcinoma, and high inequality with regard to access to treatment options within and between countries and between EU regions. The main areas for improvement that we have identified are lack of awareness of the risk of transmission, especially among high-risk groups, access to testing and treatment because once screened, lots of possibilities for effective treatment exists, and lack of specific registries on viral hepatitis to keep track of infected patients and transmission threats. And friends, in our view, the solution is national strategies or action plans focusing on the 3 areas of improvement are the main vehicle to address the shortcomings. Then individual examples of best practices exist in Europe. They need to be consistently implemented across all countries. And lastly, patients' empowerment is part of the solution. Patients need to be involved in the design and implementation of national strategies for these to succeed. This is an exciting time for those of us involved in improving the treatment of liver disease. There is a lot of interesting and innovative research taking place, and if all of us can work together closely, then I am pretty sure that we can bring about a step change in the way health systems deliver care for patients with liver disease. I hope we can grasp this opportunity. I think this index has generated a great moment for the hepatitis community to call on member states to create national plans. And now I would like to invite all speakers and attendees to join the non-alcoholic cocktail reception outside the conference room. Thank you.